We are excited for this conversation and we're excited to chat a little bit more about what you're doing, where you come from, your background, mimilabs, the big initiatives you got going forward. Um, we'd love to start with maybe just a quick intro, like high level, who you are, what you're doing. Yeah.
Noah, Isaac, it's my pleasure to be here, and thanks again for inviting me here. My name is Yubin Park, and I'm an engineer by training. I still view myself as an engineer as well. I happen to be in healthcare. I don't know why. I started my business in healthcare about 10 years ago. Then since then, I've been here in healthcare for a long time. I did two startups in the past, both in a little bit of a value-based care area, mostly in the healthcare data analytics, and that's kind of where I come from. And these days, I'm starting to build up this new company called mimilabs.
So cool. That's exciting. I've seen a lot about Mimi Labs. I'd love to know a little bit more about what that is and what you're doing.
So the mimilabs is open data lakehouse. It's built on Databricks at the moment. I been putting together a lot of publicly available data sets into one single data lakehouse. I actually originally did it for myself. So the kind of I write a lot of a LinkedIn post looking at these public data sets. I've been doing that for many years. Just downloading some files, picking some patterns, pointing out, some weird, numbers, and I often ask some questions on LinkedIn. I realized that many people liked such things. So I've been enjoying. That has been my major hobby for many years.
I would
Yeah,
say
yeah.
I've really been enjoying watching, learning. Like I don't know if there are very many other people on LinkedIn that I learn from
Yeah.
when I'm like read. I've just been really enjoying it.
Yeah, no, I don't think actually I taught much, but yeah, I think if my post taught something to you, it's mostly you learn by yourself. So because I often ask questions from the data, things I don't know, and I'm relying on others' help a lot of times. Anyways, I've been doing it mostly for me. I left my full-time job in March this year. I wanted to do a bit, more, how do you say, uh, a hobby more extensively. I, wanted to dig into the data a little bit deeper. I started to organize the data into a single place. Then soon I realized I needed a bit bigger compute power. I started using Databricks for that. I've been accumulating the data one by one since March. Around June, I realized actually I've been holding up like 18 terabytes of data. Uh, at that point, actually, I felt it's a little bit, you know, um, how do you say, wasteful just to use by myself. I started giving access to mimilabs to others, and for them to actually explore the data like me. So that's kind of what I'm doing at the moment. Uh, I want to evolve. I want the Mimi Labs to evolve to be an open and collaborative data platform where people find the data sets they need, mostly publicly available data. Data sets that are already existing on the web. Usually, you need to download them into your laptop, and you need to write some scripts to load them to explore the internal statistics and the patterns. These days, actually, I don't like to download any files, and I kind of wanted to, in the end, who knows, kind of what kind of things downloading. Actually, I don't want to download anything on my computer. I thought actually it'd be nice to have a platform where everything is already loaded. You don't need to download stuff and just the query right away. You can write complex SQL and Python, and I kind of thought that that'd be nice. And on top of that, I thought it'd be nice to have a place where people can share their script and discuss the best practice, or discuss any new problems or patterns with the others who are like-minded. So that's why I created mimilabs, and I want to just grow it as a community or platform where people can gather up, look at the data, and find something useful.
I love the concept. I can already tell you that there have been so many times where I've gone on the CMS site and tried to download a data set to answer a certain question, and only to get frustrated that it doesn't answer my question, and or it's too much data. I'm like, oh my gosh, I have to do something to this to actually get the answers that I need. But if it were all like a query away, oh, I can, oh, I want access. Like right
Sort
now.
of, yeah. No, I try to give you access to it, but it's not just the amount of file. It's not just the size of the data, but a lot of times, it needs a bit of know-how, a bit of a kind of hidden, undocumented knowledge to navigate the data. Because data without context doesn't have much meaning.
Oh, I love that.
And a lot of times, it's very difficult to find that context on the web, because traditionally, these data sets, I think they're mostly used by a certain group of people who actually do not use GitHub. So, all the scripts that navigate or that can dig up a lot of secrets of this data, actually, it's not being shared on the web. And I think that actually is setting up a fairly tall learning curve. Yeah, steep learning curve on that. Yeah.
You said a quote in there. What is it? I think you said data without context doesn't have a ton of meaning. I
Yeah.
love it's fantastic. It's such a good line.
Yeah.
I'm gonna use it a lot, and I'll
Yeah.
quote you.
Yeah. Okay. Thanks a lot. I mean, someone must have said it. I don't think actually I invented this quote, but yeah, I don't mind being quoted for that. So
So that good segue into another question, right? Because when we're sort of sharing our story, Keebler, right, with sort of the folks that we have tight partnerships with or conversations with, one thing that we always like to highlight is that we're kind of in the middle of a landscape shift, right? With large language models really being able to transform and sort of transform the way that we can access data, right? And so I know you've talked about a lot of the sort of current limitations of large language models, right, with publicly available data, but you were also wild, wildly optimistic, right, about the future,
yeah.
right? So I'd love to know a little bit more about your sort of your color or lens or perspective on this, because it's one of the most dimensional that I've seen, right,
Mm-hmm.
around how large language models will access healthcare data and change the way we use it.
Mm-hmm. So uh I don't know if it's too much of a sidetrack, but before large language model, there was a concept called the word to vec. I mean, to some degree, word to vec is kind of being seamlessly integrated into a large language model. When the word to vec, word to vector, when the concept first came out, people are actually very surprised because what word to vec was saying is the meaning of the word is actually more accurately defined by the context. So the word to vec, the concept is vectorizing actually kind of English words, but that vector is calculated by the kind of nearby words. So how the word is being used is actually more representative of what the words mean. So I think to some degree it's the same for public data sets as well. We have mostly all the metadata available. We know what the data set is about in English, and we know if we want to actually, we can get the data dictionary. If the data dictionary is not there, we can generate it. But to me, actually, the more accurate meaning of the public data set is how it's being used. So to some degree, we have this large void of how people are using these public data sets. We don't have much examples out there. So I think large language models, or maybe some of those variants, If we feed a lot more examples of how we are using these data sets, I believe a large language models will be able to find out how to use these publicly available data sets. I don't know
Yeah,
if that makes sense. Yeah, so to some degree, I think I want to crowdsource a lot of examples from people, and so that we can actually collaborate better, and so that we can actually do a bit more higher, uh, like what do you call it? More sophisticated tasks. And because of, even to get there, actually, we are still trapped by how we define certain concept, how to filter the data set, because we don't talk to each other, and we don't actually know how others are doing those things each other. And just by reading, data dictionary, actually, we may be doing things very, very differently across each other. So I think it's time to actually write code collectively and see how others are doing. And maybe using large language model, we can extract the essence of how these data sets should be used. Yeah.
I'm seeing a common theme here, right? In terms of data and context, right?
Yeah.
It feels like on multiple altitudes, it's like data without context is meaningless. Large language models are amazing because they provide context right around the
Yeah.
English language, right? Um, through the vectorization component. And now that you're saying word to vec, I'm like, oh yeah, okay, I get it. With like the decoder only, right? As
Yeah.
the architecture difference, right, on a large language model. And then sort of this, like, you take that concept and you pull it out and you say, yeah, you can unlock context, right, if you get more examples around how these public data sets are being used. So I'd love to know, like, what's a good example of like a public data set usage context thing?
I think that there are a lot of different examples, but it's kind of hard to pinpoint because I collected a lot of a diverse set of data so far. But the one example, probably what uh, a lot of people talk about is social determinants of health. And like many people say, our health outcome is not just totally driven by medical, side of the business. There are a lot of other factors, and depending on which school you are coming from, actually, that can be a 70% or 80%. I think exact number is a bit difficult to quantify, but we all agree that the large portion of our health outcomes may be dependent on non-medical side. And to quantify how much that is, and to actually address those factors, you would need some form of a public data set. I think maybe the best way is to get the information directly from the patient. A lot of times that's not easy, and because some of the kind of those qualities and the factors may be a bit uh, you know challenging to get from the person. So the one insight around that is a lot of those factors are geographically grounded. And the people have been trying to use a lot of census data, a lot of other survey data, a lot of other trends and statistics around certain geographic levels. Those things can tell about the people to some degree, and they are using that information. Maybe it's not 100% accurate, but there'll be something you can do better with that data. So the public data sets, especially social determinants of health, I think when appropriately used, they can do a lot better for the medical treatment and the building tighter or more loyal patient-provider relationships.
This
Mhm.
is fantastic. Because it's actually the next question that we were going to ask, right? Because one thing that we've been noticing around the conversation that you've been putting out, sort of in your content, is this. There was another quote. I can't even remember if it was a specific quote around, like, you you're saying that like understanding SDOH is actually really about understanding your market, not just understanding sort of the academic or social justice activity or component around it, which is historically what it's been, right? In social equity, health equity. But I'd love to dive in a little bit more. Like, do you have a really good example of how a health group might utilize this data to sort of impact patient outcomes?
To some degree, I wanna kind of rephrase the first part of the question. So the understanding the social determinants of health is not just about social justice, and it's actually more about the market opportunity. That actually there is a prerequisite for that. A prerequisite for that to happen is actually public-private collaboration, and I think the government should put the right incentives for healthcare organizations to address those needs. I'm very optimistic that the federal government and the state governments, they all know the importance of this side of the healthcare, the social determinants of health, and the many agencies are trying to come up the right incentive model. While sometimes it may come as a stick and carrot and stick, but I think at the moment incentives may work better because it's a kind of such an early stage of addressing these issues. But when these incentives are formally defined, I think it's fairly clear what private companies need to do. They need to maximize their profit based on the incentives defined. To some degree, I think to achieve this goal, we need to actually expect a bit closer collaboration between public and private sectors, and correctly incentivizing how the private sector should move ahead. Yeah.
I think I could talk about this a long time because you recognize I love the sort of baseline, requirement, right? Or condition pre-existing condition, right? Around like there needs to be a
Yeah,
good.
that's right. Yeah.
I think we know that there's been some effort around it, right? And like even like ACO Reach and some of those other programs or models that are out there saying like, hey, here's how we're going to attempt to incentivize things like that. Like I also know that some of our customers are very proactively trying to address SDOH factors when they have the incentive structure to do so, even like under a full cap model or something like that. Transportation, things like that are like the easy wins. Where is it falling short, and what's a good example of something that can be added?
So I think for those actually who are already acting on, probably it's kind of hard to generalize, but I view them as a long-term thinker, while they are planning the long-term growth. Because even if there is not much about government incentives for addressing those, addressing social determinants of health of their market. Actually, in my view, it's a long-term beneficial for both patients and the payer and provider altogether. Yeah, there is no question about that. But where things are fall short is mostly because a lot of our organizations that we have, we actually run the practice or health plan not that long term. So I think we are driven by the very short-term incentives. Quarterly or yearly incentives to address SDOH. Without much of a kind of direct incentives, people cannot quite think about that. And I think that's kind of where things are falling short. So I think if you have a strong presence in one market and you believe actually you can plan through next 5-10 years, I think maybe those organizations are easier to act on those areas at the moment. I think we need to think of how to incentivize organizations that actually cannot plan long term at this point. And those can be a startup organization or small plans or plans that they are entering new markets. Maybe just the two kind of big of corporations to look for just quarterly earnings. I think we actually need to come up from different angles and how to incentivize them for long-term growth. I think that actually seems like the path I'm thinking. I don't know whether that's right, but yeah.
That's so good. We usually ask a question around like, what if you could wave a magic wand? What's like one
Yeah.
thing that
Mhm.
it sounds like that's the question or that's the answer that you would offer? Is there another answer around like just in general around I mean I like to scope it around like accountable organizations, right? Or risk
Yeah.
bearing. Like what if you could wave the magic wand? Like what would it be?
I think that would be the case actually, how to change or transform people's mindset to plan through the long-term future. Yeah, and the outcomes. Yeah.
Oh, I love it. That's so good.
Mm.
So another question we always like to ask or end with, given our audience, like you know who our audience is, like leaders at risk bearing entities. Um, what's one question you would ask them that you want answered, that they have the answers to?
Hey, let's actually kind of how do you say, shrink the characteristics of audience. Risk bearing on it, entities can be kind of a lot of different things. Yeah. So what would you actually say about the audience? Yeah.
Yeah, so well, our I would say the groups that probably most I would say, how do I describe this? Vigorously? No. I would say the groups that we have strong relationships with are going to be groups that are in high needs. So high
Mm,
complex patient groups, larger managed care organizations, direct patient, care delivery groups.
yeah.
Um, Less so payers unless they
Mhm.
have
Yeah.
a company where they're doing direct care delivery.
Yeah. I actually have a question actually. So if I have an opportunity to ask question to those leaders, I actually want to ask, rather than optimizing your operations to the what's already been decided for the policy and regulation, if they have an opportunity to change the policy or program details, what would they want to change? What do they want to ask CMS to change to benefit their organization as well as the patients? Because what I actually, again, my very subjective generalization is that to some degree, a lot of leaders that I work with, we all have are very caring, the patients and providers and all. But often, actually, we don't ask enough questions, and we just follow what's been already determined and optimize based on it. But sometimes I think it may be just to kind of step back. It may be better to just step back, and if the direction you're heading, a lot of times it's defined by the program itself. Is the direction right? Can you actually just step back and just have an open discussion with the both public and private sectors? Is the incentive this direction the right way or not? I think that kind of I'd like to hear kind of what they are thinking. If we can actually affect some policies, yeah, for the patients and for the entities, what can we change? Yeah.
Ooh, I kind of got the jitters, not just my dog. I kind of got the jitters, kind of listening to hear you say that. Yeah, we will pose that question to our audience, and we'll see what. Awesome.
Yeah.
Yubin, it's been fantastic. Thank you so much for your time.